People with underlying health issues have a higher risk of catching the coronavirus than others. And we've learned in recent weeks that high blood pressure is the leading underlying problem in people who are dying from this virus. But we wanted some clarification on how these two illnesses are linked. So here to talk more about that is Dr. Kevin Stevens. Thank you so much for joining us, Dr. Stevens.
Good morning. Thank you very much.
Yeah, and we've been hearing this. This is the leading complication, as I just mentioned, for people who are dying from the virus. Kind of explain that to her. These people are actually more likely to catch the virus?
Yeah, well, no, a couple of things. One, people who are over 60, about 2/3 of the people over 60 have hypertension. And it noted from China that 70% of the people who died had hypertension also. And so we think there may be a couple of things into play here. One is that hypertension directly affects your heart. And with the virus, you can get myocarditis, which can cause inflammation in your heart vessels. And then that in it of itself could be more problematic for you. And the second thing is some of the drugs that we use to treat hypertension are what we call ACE inhibitors. And we know there is a relationship between ACE2 and the virus. And so when the virus attaches to that, it also may make you more likely to have problems with the viral infection. So the bottom line, though, is that take your high blood pressure medication. Number two, if you have hypertension, do social distances and try to avoid coming in contact with the virus, because as of yet, we don't have a vaccine and it's very difficult to treat, and particularly in the elderly and people who have hypertension.
Yeah, so if you know you have hypertension, then should you be even more careful about these social distancing rules and stay-at-home orders?
Oh, absolutely, absolutely. The elderly, those who have hypertension, and even diabetes. We know that diabetes as well as hypertension, it makes you more vulnerable for this disease. So you need to be even more vigilant in your social distances, as well as hand washing, as well as sanitizing your areas around you, and you have to be careful.
Sure, and I was speaking with a medical expert about this a few weeks ago, and she was mentioning how many people have hypertension and actually don't know it. She said that was a huge part of the problem.
Yes, absolutely. We call hypertension the silent killer. So you can't tell that your blood pressure is high, and many times when you do, like you have a headache or something, then it's way high and you could be in the stroke range. So you need to get your blood pressure checked. That's why routine regular visits to your primary care provider is so important, because we can test your hypertension, test you for hypertension as well as diabetes. They are simple tests, they're very easily done, and it's part of every primary care visit. So really get your regular checkups, because that we can help you help yourself.
Sure, and that's part of the conversation we've been having around this virus as well. For communities where there are a lot of people who are uninsured, who don't regularly go to the doctor, we're seeing it hit harder there, and this could be part of the reason. They don't know that they have things like hypertension.
Yeah, of course. And then it could be related to diet also. I mean, typically, some people eat high salts, and we know that salt can increase your hypertension, as well as other dietary fat and cholesterol. I need to say also, with diabetes, you can have peripheral vascular disease and your inability of your body to deliver oxygenated blood to your cells. And with this virus, you have respiratory problems. And so when you have decreased oxygen capacity in your lungs due to the lungs, then your blood is already compromised with the vessels and the vascular deficiencies. So it can really set you up for big problems. So avoid it at all possible. Stay home, stay distances away, make sure that you diet and exercise, and make sure that you practice your personal precautions like washing your hands and so forth.
Yeah, some simple things you can do to try to stay safe here. Dr. Stevens, thank you so much for drawing that link for us between coronavirus and hypertension.